we think about the cancers that we're focused on in this particular conference as being gender separate. We think of cervical and breast cancer over here with the women, and we think of prostate cancer over on the other side with the men. And I'm not sure that's entirely true. Here's some biology, for example, about the HPV that causes cervical cancer. So HPV was discovered as being the causative agent for this cancer, but it's also a causative agent for cancers in men. So men get head and neck cancers from this and cancers of other parts of their anatomy. It's a shared cancer, and if we thought about it, if we had discovered the virus before we had discovered the individual cancers, we might think about cervical cancer and head and neck cancers that are HPV related as one family. And in fact, at MD Anderson, we recently launched a research program focused on HPV cancers because we think there are more similarities between these cancers than differences. Certainly when you're thinking about strategies to eradicate them. Vaccination is obvious. Vaccination of girls is important, but vaccination of boys may also be important. And treatments ultimately may also have some commonalities. And of course, breast cancer. I already testified this morning at the plenary session about breast cancer. Breast cancer is considered a woman's disease, but it isn't. Men have breasts too. Our breasts are smaller typically, and we get less cancer, probably because we have a lot less breast tissue. But 1% of breast cancer patients in the United States, and certainly in most countries where this question has been asked, are men. And it may be that there are actually regional differences. Some anecdotal reports and small surveys in other regions, including Africa, suggest there might be a higher percentage.